So this week I am doing a vlog which is kind of a breakdown of another vlog that I've already done that's been quite popular, and I'm doing that for two reasons. One is that I keep getting lots and lots of the same questions about one particular part of that treatment, so I'm going to break it down more narrowly for people. And the second reason is I've been really poorly, so I actually managed to get proper flu just before New Year and then pneumonia. So today is really the first day that I actually feel able to make the vlog. So please forgive me if I'm a bit croaky and I'm a bit spluttery, because when the cough takes over it really does. But anyway, I'm better now and certainly on the road to recovery and really looking forward to the year ahead. So Happy New Year and welcome to my vlog. So today I'm going to talk about vaginal atrophy and using estrogens topically. So that means not taking tablets, estrogens in the actual area of the vagina. So first off, a recap. What is it? Well, it's thinning and inflammation and drying of the vaginal walls as your estrogen drops during peri-menopause, so the time leading up to menopause, and after menopause. And it gradually gets worse with time if you're affected. And not everybody is affected, but lots of women are. So why does it matter? You might think. Well, the first and most important thing is it gets very painful down there. Lots of things get painful. Smear tests, and I regularly see women not turning up for their smear tests after 50 because it's painful. Sex becomes very painful and marriages and relationships break down because of it. You can get really distressing urinary symptoms, so symptoms to do with peeing and infections and that kind of thing. So recurrent urinary infections is really common in this time. And let's not forget that women can get sepsis from urinary infections when they become untreatable because of antibiotic resistance or they're just constant. So that's a really serious problem. And in actual fact, you could consider this whole thing of vaginal atrophy and the distressing urinary symptoms as something called genital urinary syndrome of the menopause, GSM. So I think it is a really important issue. So a recap on symptoms. So in the vagina you can get burning, discharge, dryness, bleeding even, where the dry tissues chafe against each other. Burning when you pee, recurrent UTIs, urgency to go to the toilet, so you just can't wait, and then sometimes incontinence where you just can't hold it, bleeding after intercourse or after a smear test, and a shortening and a tightening of the vaginal canal, so it becomes much smaller. And when does it happen? Well, as I've said, it happens in the peri-menopause, the time leading up to when you go through the menopause. It happens after menopause when it's happened. It affects women who've had a surgical menopause, so they can be as young as 30, 25. They have a hysterectomy and their ovaries removed for various medical reasons, and boom, they get it. You can get it after you've had pelvic radiation for cancer and after you've had chemotherapy for cancer. And it's also a nasty side effect of the breast cancer drug tamoxifen and the other ones as astrozole. Probably haven't pronounced that correctly. But any of those drugs that shut down our hormones can cause it as well. What are the risks for getting vaginal atrophy? Well, there aren't many. There is some evidence that if you've never given birth vaginally, this can put you at risk. If you smoke, and that's because of oxygen supplies and blood flow to the area. So the better the blood flow to the area, the more likely you are to not get vaginal atrophy. And if you've never been sexually active or there is no sexual activity for a long time, and again that's to do with blood flow to the area, oxygen being delivered to the tissues and moisturising. So what we're going to talk about today is topical estrogens. So estrogens that you use in or around your vagina as a treatment for vaginal atrophy instead of just HRT, or any of the other treatments out there, the moisturisers and the lubricants, and we've talked about those extensively in the main vlog. So what are the different types of vaginal estrogen? Well, there's a ring, excuse me, I tried. There's a ring that sits up inside the vagina around the cervix and gives off estrogen. There's creams that you apply either with an applicator inside the vagina or as a cream on the outside of the vagina. And there are capsules or tablets that you can also put them inside the vagina. So there are 3 different routes really for this particular type. Okay, so this is the crux of my vlog. These are the questions that I keep getting asked, so hopefully I'll be able to answer them for you. It's who can have it and can I have it in these circumstances? So the first and most common question is, can I take vaginal oestrogen if I'm already having oestrogen in HRT? The answer is a resounding yes. And I know that lots of you are being told by your doctors that you can't because it's too much oestrogen, and it's just not true. So to put it into perspective, if you use vaginal oestrogen for a year in the way that it's been prescribed, it's equivalent to taking 1 HRT tablet in that year. That's how little systemic absorption you get from vaginal oestrogen. So the answer is yes. And we really do hear often that HRT works great for the hot flushes, the anxiety, the bone pain, the skin, but not the vagina. It doesn't always help. So it's really important, if you still have vaginal symptoms after taking HRT, that yes, you can have topical estrogens on top. And we've got lots of patients who do, and long term. Can I have it if I have breast cancer? Now this is a difficult subject and it's always going to be emotive, and doctors still have very differing views on this. But the evidence that I've read on that absorption, which is so low, is that yes, you can. Because what's the point of having survived breast cancer and having your life ahead of you, but being miserable because your vagina is actually your main focus because of the pain and the discomfort and the incontinence? So the absorption from topical HRT, as I've said, is teensy, absolutely teensy. So the chances of it being a problem in breast cancer is really, really low. You can read Avron Blooming's book, Estrogen Matters, and it's covered in there. And a good oncologist who's up to date should know about that absorption and should allow you to have vaginal estrogen, even if they feel you can't have oral estrogen. So speak to your doctor, but the evidence is yes, it should be fine. Can I have it if I can't have HRT? If I've got contraindications to HRT? Now, firstly, there aren't many contraindications to HRT. People often worry about DVTs, stroke, lupus, breast cancer. We know that if you have HRT through the skin, there's no risk of DVT, stroke, over and above that of your normal risk in society. The same goes for things like lupus and clotting disorders if you deliver it through the skin. If you don't have a uterus at all, and so you're having estrogen only, then your risk of breast cancer is actually reduced. So the answer is, if you have true contraindications to having HRT, can you have vaginal estrogen? And the answer is yes, usually you can, for the same reasons, that the absorption is so low. Some women have asked me about migraines because when they take HRT orally, their migraines get worse, and this does happen for sure. And sometimes we can tweak the dose or the way of delivery, but still the migraines are there. So they don't want to take HRT, or they can't because of that. But they still have these debilitating vaginal symptoms. Can they have topical estrogen? And again, the answer is yes, because the absorption is so low that it should have no effect whatsoever on migraines. Can I start at any age? So if I'm 70 and I've never had HRT, can I start vaginal estrogen? Yes, because the absorption again is so low that it doesn't bring with it the same worries as starting HRT at 70. And we certainly would think long and hard about starting HRT at 70, but not vaginal estrogen. So if you're getting to that age and you've been without vaginal estrogen for so long that you're getting recurrent urinary infections, life is miserable, you don't want to keep taking antibiotics, can you start vaginal estrogen? Most definitely. And I quite often start in these circumstances. Can I start before my periods have stopped? Yes, of course. Because just because you're having periods doesn't mean that you're not perimenopausal. And if you're perimenopausal, your estrogen is lowering and lowering, and you could have vaginal dryness or atrophy. So yes, you can. And that's a really common one that I get asked. I don't know why doctors have this obsession with periods and HRT. Women can have periods for 10 years and be perimenopausal and be miserable. So treat it, please. If you've only got genital urinary symptoms, so repeated urine infections, painful sex, incontinence, all of those things that I listed earlier, and you don't want to have HRT, or you can't have HRT, or you have tried it and it just didn't agree with you, it's not for everyone. Can you then just have vaginal estrogen? Yes, you can, definitely. And it's probably absolutely the right thing for you to take away those horrible symptoms, stop putting you at risk of UTIs and sepsis and all of those things. So yes, you can. This is one I'm being asked lately. I've had adenomyosis, fibroids, they're estrogen fed. Can I have vaginal estrogen? Now the answer is yes. We don't really know about estrogen in HRT and if it feeds fibroids, but in some women it certainly seems to, so they can get worse. So I think the answer is this: try it. Try it, have a scan in 6 months' time and see what's going on inside your uterus. Check the lining, check the fibroids, check the adenomyosis, and make sure that it isn't growing as a result of the HRT, as a result of the estrogen. But yes, again, why should you suffer terribly? There isn't much downside. The absorption is really tiny. It may have no effect at all because the absorption is so local to the vagina, but it's worth trying and monitoring and seeing how you go. And that's really the best answer I can give on all of those questions. So those are the questions that I'm being asked over and over again, and they're really sensible questions and they do need answering. So I guess the other thing to just cover, because we're talking about a medication, is there any caution? Is there reason to not have it or to think about it? So the answer to that is the data on long-term use, and you do need long-term use because if you sort the problem out for a year, then stop it, it will return. So we need women to be on this long-term use. The data isn't really there. I can't quote major studies at you at the moment, but from what we're seeing and the evidence that is slowly emerging, it looks safe. It looks like you can have this long-term, be comfortable and live your life without being totally focused on the pain or the discomfort or the lack of sex or whatever it is your individual issue is, because of vaginal dryness and atrophy. The only thing I would say is some women get bleeding because of vaginal atrophy. If once you've treated it for a few months and you're no longer dry and painful, so there isn't chafing down there, so there's no good reason to bleed, if you bleed at any point, please see your doctor and have a scan. It's as simple as that. Now, I just want to give a shameless plug to a woman who's done lots and lots of work on this. Very good work, and she's written a book. That book is called Me and My Menopausal Vagina, and her name is Jane Lewis. She has a Facebook group for women that are suffering who can share their stories and support each other. Well worth joining if it's you. And I will put a link to the book for you in the comments afterwards. And hopefully you'll get even more help there because it's a great place for help. So as ever, I hope it's been useful. I'm sorry it's been brief. I'm amazed I only coughed once. And please ask me any questions that I haven't covered, because there's always some, and I will answer them in the comments afterwards and make suggestions for vlogs in the coming year, because I'll research them for you and I'll cover them. And as always, thank you so much for watching and for supporting me, and a happy 2019.